Actually, today is a very important topic. The reason why I say that is because I have actually saved many people in ICU. They have heart attack, and many of those people are diabetes. Another one is in Hong Kong. I actually have people that actually come to see me with high cholesterol, and because of LOWSUTEA, it start bringing cholesterol down. I have actually a patients who is one diabetic, second cholesterol extremely really high, and with LOWSUTEA, it actually helped to brought down the cholesterol. But because of that, the doctor was saying, wow, this is impressive. However, because of years of subclotting and so forth, they still end up, actually he has to go to do a bypass, but at least the cholesterol are much better. So it was very happy for that patient. And even the patient was even say that I wish I know you like 10 years earlier, so I don't have to get into this situation. So really, at the end of the day, heart attack is a serious issue. If you do not pay attention to that, you are in serious problem, especially if you are potentially a diabetic, because I'm going to talk a little bit more about diabetic heart attack. Can be so-called a very silent disease or silent heart attack, if you will. And that way, you might not recognize that is a potential heart attack coming. So really, at the end of the day, I'll give you some sign and symptom that you have to watch. And so it will be somewhat different from a typical person heart attack. So this can be a very good life-saving, lecture for you. And I can tell you, I have actual patient die in front of me, and I revived that person. And lucky, some of them survived. Some of them, unfortunately, do not survive. So that's why I thought today, this can be a very meaningful topic for everybody. And thank you, Faye and Gordon, all these people from Hawaii listening. I have a bunch of people from Hong Kong attending also, Philippines, and also Canada, and people from other part of the United States. So really so happy you folks are actually spend this time, because this is going to be a very important lecture, can help you to potential saving your life, as that's most important, isn't it? Hello， 各位同事朋友，我係 Angela LOWSUTEA President Vice President 嘅 President 今日有一個好特別嘅節目咧，就係關於即係心臟病同糖尿病有咩關係咧，或者前期患病點解我 eventually 都顧慮呢個心臟病咧？其實原來咧喺糖尿病同普通嘅心臟病咧係有些少分別嘅，仲有其實有個 sign symptom 都好唔同，因為你感覺上冇咗啊。咁所以變咗嚟講咧，今日嘅講座咧係對你醫人生裏邊咧係好重要。講一個古仔俾你聽，就有個我哋嘅堂友啦嚟到飲我哋嘅去糖茶啦。咁佢哋話：嘿，你飲咗我飲咗半年去糖茶啦，我啲 cholesterol improve 咗啊！但係因為佢已經係好遲再嚟啦，咁佢個塞嘅情況咧，喺佢嗰個心臟咧大血管咧，其實都好塞㗎啦。咁個醫生都係要佢繼續去做呢個叫做bypass 啦、搭橋啦，講得為啊。咁即係佢個情況下咧，佢自己話：哇！我10年前識你好啦，咁我就唔會用呢樣嘢啦。咁你梗係睇到咧，其實咧最低限度我哋幫助佢降低咗佢個膽固醇同埋佢嘅糖，咁變咗佢唔會塞得咁緊要。但係冇辦法，因為呢個唔係一日嘅事嘅，係要長遠發展，所以變咗嚟講咧，我哋能夠幫助佢防禦到咧，佢唔會有 heart attack 已經係好開心，好開心啦。Okay, so today let's start the webinar, and I think it's so important to better understand what is heart attack. And I think if you get to know this, this is going to be wonderful, and you can able to really at the end of the day. So I will share this slides. I wonder can everybody can see this slide? Can Gordon, can you give a 1 at the chat, so you, at least I understand that you can see in your Zoom. Okay. Today's topic is really diabetic heart attack. What is the connection? Why does the heart attack? I'm a diabetes only, right? But you know, diabetes, if you don't take care, you will eventually either you're going to have other health problems such as heart attack, or kidney problem or stroke problem, right? So today I thought that we'll focus on heart attack so you can have a better understanding. So net result, you will have, prevention. If you can look at, wow, this is potential attack, or at least you can go to see doctor and find out whether that is truly a heart attack coming. Because if you do not, net result, the consequences is very, very high. So I really appreciate people today. There's a lot of people today actually attending this webinar from all over the world. And I think this is going to be something is so valuable to them because it means it is your life. If you got a heart attack and you are not really getting medical treatment, in 20 minutes, you are gone. And I actually saw so many patients because as an ICU nurse, I had treated many patients, including in Hong Kong. Actually, I see people just drop because heart attack, and they can be revived, but because they can't get into medical treatment fast enough, they pass away. So this is real. So let's serious about that. So today we'll talk about what is LOWSUTEA and what is the type 2 diabetic, how they work. And then from there, we'll talk more about heart attack, and we'll talk lots about them, talk about serious, how diabetes related to heart attack, what is it link, and then how can you damage your heart, and then what is a silent heart attack related to diabetes, and we'll summarize it and make sure that you have all the signs and symptoms, understand, remember, maybe take a picture, so in case you have that, you go to medical treatment fast. Okay, all right. So 今日講座咧係有幾個題目，第一咩叫去糖茶啦，同埋咩叫做異型嘅心臟病啦，同埋咧仲有咧就係啲情況係點樣咧？咁你要防禦啦，又係影啲相啦。咁我哋能夠咧應該會逐步做解釋俾你聽。咁希望咧你能夠知道原來呢個糖尿病嘅心臟病嘅發展係點，同埋一個跡象係點咧，你可能夠防禦。So as you know, everybody know what is LOWSUTEA, and some of my new friends here might not know. Actually, LOWSUTEA is a sugar cleansing tea that combined with powerful nutrition as guava leaves and bitter melon. And the benefit is that the people can take LOWSUTEA, prevent them from pre-diabetic conversion. If they're diabetic, they can actually prevent them from become diabetic complication, and they can reverse and become like high cholesterol. They lower the cholesterol, and their hypertension, lower the hypertension, and also can be detox. And so this is a really great natural product. And plus we have a winner best natural sugar cleansing tea trophy in 2021 because Hong Kong they gave something that a product that really benefit mankind. This is truly benefit mankind. 各位同友，今日講咩叫去糖茶咧？其實去糖茶咧就有一個番石榴葉啦，同埋苦瓜，咁佢幫助我哋嘅糖尿病者咧降低佢血糖啦、膽固醇啦、血壓啦同排毒，即係降低係三高啦，同埋咧幫助佢哋，如果佢前期患病，佢唔會轉咗佢係糖尿病者。如果糖尿病者亦都唔會係一個嚴重嘅糖尿病者。So how does LOWSUTEA help? Basically, lower your blood sugar, lower your cholesterol, especially LDL cholesterol, lower your blood pressure, and also detox. Now, why this is so important? 嗱，各位朋友，其實咧點解降低血糖、降低膽固醇、降低血壓同排毒咁重要咧？咁其實咧因為喺呢個去糖茶咧有一個好容易作用。第一咧guava leaf 咧就將啲糖咧俾佢唔好入去血管裏邊，即係降低佢個減慢佢糖嘅吸收，血管裏面吸收。但係如果啲血管糖入咗去之後咧，苦瓜有好處咧就點咧？佢就將嗰啲糖增加佢胰島素嘅敏感度，就帶翻啲糖入細胞裏邊。咁同埋仲有咧喺尿嗰度掉咗出嚟，同埋咧就掉埋個膽固醇出嚟啦，同埋佢個鹽出嚟啦。咁最後咧你個血壓降低啦，膽固醇降低啦，糖降低啦，仲有排毒。So the really simple thing LOWSUTEA works is basically 2 ingredient guava leaves and bitter melon. What it does is actually got guava leaves is actually delay the absorption of the sugar into the vessels, and bitter melon increase the insulin sensitivity, took the sugar into the cells, and also dump sugar out from our the sugar dump from the urine, and also cholesterol dump from urine, and blood pressure. Net result, the sugar, cholesterol, salt gone down, and salt gone down, blood pressure will gone down, and also detox. So it's very simple product, but one thing good is it works. A lot of people have so much benefit now. I got so many positive comments with that. That's wonderful. Plus, that is not enough. Our company also provide everybody, lectures regarding of how to on diet. We have hundreds of lectures now in YouTube to teach you how to dieting and so forth, how to drink LOWSUTEA to help you lower blood sugar. You also exercise 8,000 to 10,000 steps per day, for example, and how to control weight, lower your BMI. And also weekly webinar like this one. We give you really real life how to manage diabetes and prevent all the symptom and sign that you can able to observe, plus how to track your blood, because only way you can track your blood to understand lower your A1C from maybe 10 plus to all the way to 5.7。各位堂友，好重要咧，去糖茶咧係一個好簡單嘅東西。我哋仲有咧唔淨止講幫你飲茶講咧，就我哋教埋你點管理呢個糖尿病或者前期患病。我哋有點樣飲去糖茶啦，同埋每日去做咩 exercise 咧，食咩能夠降低你碳水化合物嘅東西啦，減低你重磅啦。我哋每個禮拜都有醫生講座啦，同埋咧每日都量即係我哋嘅血啦，咁就降低我哋個 A1C 由10至到5.7以下啦。咁所有呢啲咧係幫助鼓勵你嘅，因為咧個問題咧你知道啦，糖尿病係一世嘅病嘅，我哋一定繼續鼓勵，因為如果唔係咧，整下你又唔記得咗唔做咧，咁就有啲糖係受翻去嘅。And everybody actually go through 4 stages of diabetes, and this is really important to remember what it is, because if you remember that, you can really prevent this happening. Then you might not even get down to the first, pre-diabetic stage. The problem is a lot of people don't realize, especially I think in Hong Kong, a lot of people, and actually United States also, a lot of people don't realize when I have high LDL cholesterol going up. And so net result, you will damage your B cells. A B cell is the insulin, come up with this B cell, take the sugar into the cells. However, B cell damage, the sugar continue increasing in the blood vessels. And net result, the cholesterol and the sugar mixed together, your vessel become inside, all the blood become very thick. And when that thick, the second stage will come on, which is where all the cholesterol stick together, it will form plaques everywhere, the entire body. Now, this is the most damaging for anybody who are going to be a diabetes, because the first year plaque, no problem. Second, no more. And as you go on 10 years later, it's plaque everywhere. That's where the major problem of diabetes. And so net result, the second stage, usually your blood pressure goes up. That's why now I suggest people who have diabetes, not only diabetes, people who have high cholesterol, LDL cholesterol, or high blood pressure, they need to start drinking LOWSUTEA, so they will never fall into the third stage, which is the pre-diabetic stage. Now, how do I know pre-diabetic stage? Is very simple. Every doctor do the same thing. They measure this hemoglobin cells, which are holding oxygen, but everybody have that. But the lab will measure the amount of percentage of sugar which attach to this hemoglobin cell. If you are 5.7 and lower, you're a normal person. If you are 5.7 above until 6.4, you are pre-diabetic, and every doctor do the same thing. So that is an important thing to check when you got to see the doctor. Unfortunately, if you are pre-diabetic, you know what? You have no medication. The doctor will just say, hey, you are pre-diabetic, you got to watch your diet and so forth. So you really no more treatment, except one thing now, you have LOWSUTEA. While you are pre-diabetic, and drink this LOWSUTEA will help you to lower the blood sugar, lower the cholesterol, lower your blood pressure. So net result, you never get into the diabetes stage if you can able to do your exercise, your diet control, your weight control. Wow, if you can able to do that, you can actually save at least 16,000 just on healthcare costs per year. If you can delay you yourself to convert to a diabetes, you are accumulating over 33,000 US dollars per year on expenses all the way for 20 years. So that's almost a house, okay? So imagine that if you can able to prevent yourself to be a diabetes, you save a lot of money. Plus, you have good health, enjoy a lot of health. But if you don't do anything, unfortunately, you become a stage 4 diabetes. Anything A1C over 6.4, you are became a diabetic. 各位同友，呢4個 stage 係好緊要嘅，記住。第一個 stage 咧就係 LDL cholesterol 上嚟啦。當 LDL cholesterol 上嚟之後咧，你嘅第二樣嘢咧就係嗰啲糖嘅胰島素出嚟嘅嗰個胰臟出嚟嘅個叫 B cell 帶啲糖入去嗰個細胞裏邊嘅。咁當你個胰島素嘅 B cell 成日咧俾個 LDL damage 咗、損壞咗，咁就做唔到嘢咯。咁啲糖就繼續高啦。問題出現啦，因為啲糖再加埋嗰啲膽固醇就會好結。咁第二個 stage 就出現咧，就係你血壓會上升。咁你血壓上升嘅時候咧，其實糖尿病就最弊呢樣嘢，全身同你係咁塞，所有嘅血管都係塞嘅。哇！你幾大問題啊？咁第三個 stage 咧，第二個 stage 血壓上嚟咧，咁第三個 stage 就會好快出現啦。咁呢糖嘅升嘅時候咧，你個紅血球叫hemoglobin 啦，咁個紅血球咧就 measure 有幾多個 percent 嘅百分點嘅糖黐喺呢個紅血球度。如果你 under 5.7咧，你係普通人啦。但係如果你多過5.7至6.4咧，你弊啦，你依家係叫前期患病。但係好可惜喎，前期患病嗰陣時係冇咩啊，冇藥食嘅。咁醫生就叫你喂唔好食咁多甜嘢啊。咁所以咧，其實飲去糖茶有幫到你啦。呢個時間咧飲去糖茶，仍然降低你血糖咧，係降到控制你係低過5.7或者低過6裏邊啦。咁你成日唔上嘅時候咧，你可能有20年後你都係 pre-diabetic。嗱，呢個係好重要喎，因為美國啱啱有個 study 出嚟咧，你每年咧淨係醫藥費啊，如果做咗糖尿病者係16,000一年。如果你20年裏邊你唔係咗糖尿病病者咧，哇！你幾開心啊！你有大概260萬港紙係 save 咗嘅。咁同埋仲有一樣嘢咧。如果你去咗即係糖尿病第4個 stage 啊，好慘啊，因為你會好多問題出現。So what kind of problem if you really convert and unfortunately become a diabetes? One, you have stroke issue, memory issue. I'm sure you have a lot of friends, relatives that find, oh, what I can't remember, right? So all that will be causing you tremendous problem. Plus, you have cataract issue, you have pancreatic issue that you cannot have insulin, you may inject insulin, you have heart disease, which today we'll talk about. High blood pressure, your vessel is all damaged, it's hardened, nerve damage is terrible, you cannot feel, you have all kind of problem, you have constipation problem, you can have a stomach problem. If your wound don't heal, you're going to get your foot get cut off because of gangrene, you have diabetic nephropathy, well, all kind of problem come in. So it's really sad. Okay. Plus, you may have potential pregnancy, and sexual pregnancy is your gestate diabetic. And also you have sexual dysfunction. So all that can be really, really a problem. Okay, now we will talk about a little bit more about what is really, why is a high risk to be a diabetic when you have heart attack. Now, do you know that, first of all, if you are diabetes, you have a 50% chances, higher risk heart attack than a non-diabetic person. 50%, that's a lot of people, okay? And on top of that, people who have heart attack, they tend to have less potential survival if they are diabetes, okay? So the heart attack are so important because all these diabetic patients, 45% of heart attack, they tend to be also men instead of women. And on top of that, 35% of the people with diabetes tend to die after suffering heart attack. Instead of typically they can survive. So keep that in mind. The statistic is not good for you because really at the end of the day, 50% of people who get higher risk get heart attack for diabetes, okay? and they don't tend to survive。嗱，各位堂友，一個好慘嘅問題咧，就係原來糖尿病發生嘅病發症咧，高風險咧係50%嘅原來。咁同埋仲有咧，有個好弊嘅問題咧，如果佢係即係糖尿病啦，咁多數咧男士咧係45%咧係喺有呢個心臟病多過女士嘅，仲有35%如果有呢個糖尿病嘅心臟病咧，多數咧都會死嘅，所以變咗嚟講咧，死亡率好高喎，所以變咗呢個係要十分重視嘅。如果糖尿病者 ，OK？So let's talk a little bit. What is heart attack? Okay. Now, in heart attack, a lot of people call myocardial infarction, which a typical medical term talk about really is the blood vessels. This is all the coronary artery vessels. Okay. Unfortunately, if your blood clot cholesterol right here is stuck, the blood cannot no longer flow through your arteries anymore. You know what? Then your blood will start dying in here. Your muscle will start dying, and dying this muscle will take only 20 minutes. So imagine that if you do not get yourself the blood going through very quickly, your heart right away will die very, very quickly. And diabetes have extremely high risk. And once this, because of the fact that you have no blood supply in this area, the muscle died because it don't have nutrient, oxygen, as simple as that, okay? So really very important, you need to basically, once you get this chest pain or whatever, you gotta make sure these clots or the plaque has to have some room to give your blood continue to pass through so you don't get a heart attack. Now, a lot of time, a typical person will have pain, but some of the diabetes, because of the fact that they have nerve damage, they will have no pain. Imagine that. So you will end up actually died without even, knowing it, okay? So that's why this lecture become very important, because your diabetes, your actual symptom will be very different from the people who are normally will have the feeling of the pain, and you might not because you're diabetes. Okay? 嗱，各位堂友好重要，點解今日我會講多些少咧？因為其實喺呢方面嚟講咧，第一，如果你嘅心臟呢個心臟啦，呢個成個心啦，呢啲就係你嘅大嘅心臟血管啦。咁但係個問題咧，因為如果你嗰啲膽固醇啊，同埋嗰啲 plaques 咧，同埋血塊咧塞咗呢度咧，血過唔到咧，弊啦！你呢個 muscle 咧，呢個heart 嘅嗰個肌肉咧，就好快脆咧就會死嘅。咁佢死咧係 take 幾多時間啊？20分鐘。所以變咗嚟講咧，如果你有一個心嘅痛嘅問題咧，咁你就要快啲食啲離體丸啊、藥啊，呢啲能夠令到血管咧係好快咧能夠擴張翻俾血流入嚟。但係如果你冇呢樣嘢咧，弊啦，你就會係個 heart 咧個心臟咧就好快死，即係個心臟嘅 muscle。如果死呢啲地方啊，任何呢啲地方，你咧就已經係個心唔 work 噶啦。咁個唔 work 咧，咁你就 basically 就玩完噶咯。所以呢個咧係知道你個情況咧係一定心臟病發嘅時候咧，你一定要快去揾醫生醫治，係唔係去醫療室啊？係去醫院啊！記住啊 ，OK。所以其實呢個咧係一個好嚴重嘅東西嚟嘅 ，OK。So really at the end of the day, diabetes really have a major issue because you know why? A lot of time the diabetic have what they call neuropathy. In other words, the nerve are damaged, and so their blood circulation to the heart is also become poor, and they form neuropathy. Plus, the nerve are damaged, so they can't sense the pain. Remember, we said just now, if I have this issue here, I will have pain. But your pain will not be there because you have nerve damage. So net result, your heart attack become very, very unsymptomatic. and you might not able to detect. So if you have a smaller sign, you might need to really fast and see the doctor or go to emergency, because this can be a very serious issue to people who are diabetic with potential heart attack. OK， 嗱，糖尿病咧個問題咧，因為佢係有個神經嘅損壞咗，所以咧係好嚴重咧。佢有一個好常見嘅併發症出現咧，就係佢心管裏邊咧就已經原來塞咗，但係個問題咧，佢塞咗之中咧，佢係嗰啲 nerve 啊，嗰啲神經系統啊，感覺唔到啊，感覺唔到佢冇痛喎，咁冇痛咪冇個跡象出嚟啦。如果冇呢個跡象咧，個情況咧就好嚴重啦。因為咧，我係如果普通人嘅，我就會心臟好痛啊，咁你就會睇醫生係咪？如果你係冇咗呢啲咁嘅即係神經系統話俾你聽嘅時候咧，咁你咧就未必咁早發現嘅時候咧，所以咧，如果你有些少感覺，應該俾啲 sign symptom你就真係要快去睇醫生啦。如果唔係咧，就係一個好大問題。亦都有好多時候咧，要早啲去檢查到你個心臟係唔係已經塞緊好緊要咧，可以做一個 angioplasty 啊，呢個angiogram 啊，嗰啲咁東西去做呢個 determination。OK， so in order for you to really do that, you really need to early, if you have a little sign of understanding your cholesterol is very high, your diabetes, you might need to actually also get early to check what they call an angiogram, meaning check the heart, see whether is your blood vessels are still very good, or you have any really plugged heart vessels. Because if your heart really stop working, you end of the story. Okay, just keep that in mind. And able to damage your heart and heart muscles are basically blood clot. Hardening of the artery is called arteriosclerosis, or your muscles already damaged once and eventually become scarred, so the muscles are no longer at that area working real well. Plus, also because you have diabetes, you have all kind of vessels are all swelled up. So net result of that, your swelling blood vessels are also become making issue to damage your heart muscles. So all these things, actually, you might need to get a doctor or heart person, a cardiologist to examine, to check you out, or do what they call a angiogram, meaning they put dye inside your heart to check your heart whether anything was stuck. Okay. So really, 所以如果係糖尿病者點能夠損壞呢血管同心瓣咧？咁其實咧，第一就係有好多血塊咧塞住晒嗰個血管嘅流通啦，唔流通到啦，同埋個血管硬化咗啦，同埋仲有你可能你啲心臟個肌肉咧係已經損壞過，咁裏邊咧就有啲 scar tissue 啊，即係有啲壞咗嘅tissue。咁同埋仲有咧，你嘅血管係腫脹咗嘅。咁嗰啲血管咧又可以硬化啦，咁呢啲嘢全部令到你咧個心咧個肌肉咧可能壞嘅。咁如果你個好嘅心臟嘅血液咧，你睇下呢個血管咧全部都係紅當當啊，啲血管咧流得好通當嘅。但係如果唔係咧，你血管咧就會係好多變咗唔係咁靚咧。咁呢啲咧全部係要由呢個心臟咧去睇個 angiogram，OK， 即係用個攞啲帶入去個心臟嗰度咧，去睇你心臟係咪行得好啦。So really at the end of the day, you really, if you have any future potential sign of heart problem, you really need to have an angiogram to look at all these vessels. Are they still functioning well? And if any blockage, and if you do have blockage, either you have to end up with a bypass, or you have to angioplasty, we get a balloon and go in there, expand back the heart, the vessels. So all these require really act on by a cardiologist for you. And that really, at the end of the day, potentially save your life. If your heart doesn't work, nothing will work, because the heart is like the major engine. The engine, you have to keep pumping. If your engine don't pump, you die. And you are end of your story. 嗱，各位堂友，如果你個心臟唔 work 嘅話咧，你好弊啊，因為咧心臟係你架車嘅 engine。 一樣。如果你車 engine 唔 work 咧，你就架車全部唔行得，你就拜拜。咁所以變咗嚟講咧，即係要好小心咧。記住，你一定要俾個心臟醫生去 check， 然後睇下你嘅心臟如何。OK。One of the problem I would say, especially your diabetes, is they have what they call a silent heart attack. The problem with that is because of the fact that you have diabetes, you have all kind of nerve damage, diabetic-related neuropathy. In other words, your heart would also have muscles and also some nerve. Some of them are already damaged or get plugged. So you might not necessarily have feel the symptom of heart attack, meaning usually you have a signal of wow, sharp pain. You might not have that. You might have a slightly duller pain or lesser of the pain. So net result of that, you might not recognize this is truly a potential heart attack. So this is called a silent myocardial infarction. Wow, that's scary. Meaning that even though I have a heart attack, I might not aware. That's the reason why today I want to make sure that you identify or you understand what to identify what is a typical diabetic heart attack, because this might be your lifesaver. Because with that, is this heart attack might be very different from all the other heart attack of people have, and the sign and symptom is very different. 嗱，各位堂友，因為你係糖尿病病者，所以咧你係一個冇聲，即係無聲嘅心臟病發作嘅人士係好高嘅。點解咧？因為咧，當你係嗰啲血管係塞晒之後咧，咁個問題出咗嘢就係你係感覺唔到你心臟病普通人有痛咗又痛啦，你冇咗痛喎，哇冇弊，所以變咗咧你冇咗呢樣嘢嘅時候，你就唔知道呢個心臟病係嚴重啦，有血管啦，或者係有關神經變化咗啊，有個心臟病嘅問題出咗現啦，所以你唔知道嘅時候咧，個問題出現好大問題啦。咁冇咗個信號嘅時候咧，你可能都唔知喎，有可能亦都冇個 sharp pain 喎，冇咗好即係好辛苦嘅時候，你係少少痛，咁你唔知嘅時候咧，你亦都未必係會即係繼續去幫助你咧係去去睇你嘅心臟病嘅問題，所以喺呢樣嘢裏邊咧真係要好小心啦。So you are very right, Eugene. You exactly right. The reason why I want to talk about this subject is because of the fact that we'll talk about silent heart attack for diabetes. So you got to really watch. And this is something very serious. Thanks, Eugene, for giving me some comment here. Now, silent heart attack is basically they really because of the fact that even the heart are really damaged. You know where they start plugging and basically your scar tissue already there, and then the heart attack usually started maybe a little bit and you didn't recognize, but the next heart attack comes in, an even bigger problem will always shows up. So usually when you have a silent heart attack, you really gotta understand you have some kind of heart attack, a silent one. You gotta get a doctor quickly, and then you gotta talk to the doctor to examine, maybe very quickly do an angiogram to identify where is the issue, and then you gotta talk about the risk that you are gonna have a potential bigger heart attack. So you gotta very quickly to get to the doctor to understand whether you have a silent heart attack. 嗱，其實咧，因為個問題咧，你冇乜感覺啊。咁如果係真係有一個心臟病嘅問題出現咧，咁你咧就要真係要好快脆咧，要俾醫生知道啦。因為如果唔係咧，你下一次嘅 heart attack 咧就更加大問題出現嘅。咁醫生出現之後關注咗之後，你就最咧就有即係能夠 treatment 啦，同埋你係二型嘅糖尿病病者咧，咁佢都會知道如果係咁咧，你好咧，因為你 nerve damage 咧係塞咗嗰啲神經系統，咁可能咧你係冇感覺嘅，咁佢都知道咧，如果咁講咧，我真係要快啲去同你醫治咗啦，或者俾啲藥丸你離體藥丸俾你，能夠有咩事發生，你快啲食咧， 咁你而家降低你個風險嘅，因為二型糖尿病者咧，呢個問題咧，你係好大問題嘅嗱。The next slide will be very important. I would suggest you take a picture. That's the reason. Because a lot of people don't realize you gotta really, at the end of the day, this is a typical diabetic heart attack, which is called a silent heart attack. Usually people will getting fatigued, tired. They might get some nausea, they got some upset. By the way, they don't feel a lot of pain into the chest, unlike a typical heart attack. Your leg usually are swell up, and then you might have some heartburn feeling, and also you follow up some difficult breathing. Now, really get more and more serious, then you really get some pain, pressure squeezing right here, and then eventually you're gonna get your left chest feel really uncomfortable. But the major difference, you don't have sharp pain like a typical heart attack because of the silent heart attack of a typical diabetes. The sharp pain, a typical person get that warning because you don't have neuropathy, right? You don't have nerve damage. But if you are a diabetes, since you don't have the nerve, you have the nerve damage, you don't have that feel. So this is really a major difference. Plus, you have no physical, but you start sweating, and then you go feel dizzy and lightheaded. All these on the left side are all the serious symptoms, and the right side are the slowly developing symptoms move to this area. So I would like everybody to take a picture so you know. A lot of people misunderstood and say, hey, you know, I'm I know because if I had that, I'm gonna have sharp pain. But this one, you're diabetic, you don't have that. So keep that in mind. So net result, you can be very, very serious because of the fact that you did not have the typical real problem symptom. Okay, so take a picture of this, and I'll move to the next slide. 嗱，各位堂友，因為你係糖尿患病者，所以咧你會係一個叫 silent heart attack， 即係聽冇真正好似普通人嘅心臟病咁嘅。咁多數啲人咧就會開始好疲倦啦，好攰啦，成日都同埋咧有反胃啦，好作嘔作悶咁啦，個肚唔舒服啦。咁好多人咧就誤咗我係腸胃病，其實唔係，因為咧其實你嘅問題咧出現咧係你有心臟病嚟緊嘅。咁隻腳就會腫啦，同埋咧講得好似哇係咪個胃氣個身體胃氣啊 burning 啊咁同埋咧呼吸開始有困難。當你更嚴重啲嘅時候咧，你就感到咧呢度好多壓力，開始痛，但係又唔係 sharp 咁痛喎，即係唔係好激烈痛。普通人啊，最重要個 difference 咧就係普通人咧就會 sharp pain 嘅同埋 radiate up to 呢度上去嘅。咁但係你如果係糖尿病者，因為你個 nerve 神經系統已經損壞咗，你就 end up 咧就冇咗個痛嘅問題。咁仲有一個好大問題咧，就係你個有飆冷汗，同埋咧又開始有頭暈。嗱，呢啲咧係全部咧，亦都係呢個將你個 silent heart attack 咧係喺diabetic係會出現嘅。所以或者你影張相啦，咁最低限度咧。你知道喺呢方面咧係有呢個問題出現。So I people that in Facebook, you can also give me a like if you want to. So at least I know who you are at. And then so 如果喺邊個喺 Facebook 睇緊我 live 咧，你俾個like我啊，咁變咗人家我最低限度咧，我係知道即係你係邊個睇緊Facebook 嘅。咁多謝你各位幫手係。Okay, so important is there's a major difference of typical heart attack and also a person who doesn't, and also a person who are not necessarily sorry. You got to understand the diabetic heart attack and a typical non-diabetes heart attack are different. The major difference here is diabetes usually might not have sharp chest pain. Keep that in mind. And the left side from here go all the way down, the left, from left to all the way down are getting more and more serious. So, so it will be good if you can help me to basically take a picture of this so you can remember what is the sign and symptom look for, because I want to make sure everybody can be healthy in that sense. So that way you can be able to live longer, okay? Now, as you know, the factor which give you a heart attack are one, you have diabetes, okay? You are diabetic, you have a high chance, 60% potential people are having heart disease. And with heart disease, you have a high chance of you have a heart attack. So that is a serious problem. You have diabetes, you got to watch a factor, a high risk factor, heart disease. Second, you're also being overweight. Okay, if you have a BMI over 30, you also have a high chance of heart attack. Now, when you're overweight, another problem you have is you have a big tummy. Okay, a lot of people didn't know if you have a big tummy, you have also a high chance of, potential more higher chance of heart attack. Plus, you also have poor dieting. In other words, you don't eat fiber, you eat a lot of sweet, a lot of processed food, a lot of fats, a lot of red meat. You also become a poor diet item, you can have also a high chance of heart attack. Also, one more thing is high cholesterol. In other words, you might not have basically a diet issue, but you can be actually a person because your family has a history of high cholesterol. You also have potential heart attack. I'm going to share with you a real story. One friend of mine who have a family of high cholesterol. In other words, the mom had high cholesterol, dad had high cholesterol, the brothers and sister all have high cholesterol. He himself has high cholesterol also. Unfortunately, I didn't know about his case. His high cholesterol can got to really high. The blood, the coronary artery has stuck all the way to 99.6%. Imagine that. In other words, the doctor saw it and said, wow, you leave this clinic, you might not come back. So right away, he has to get to the hospital, do emergency angioplasty, balloon angioplasty. If not, this person will die. So that is really scary. So high cholesterol cannot ignore. That will be and that could be genetic, could be diet related, could be you don't exercise, could be all kind of reason. You got to check all the time cholesterol. High blood pressure is another one. Your blood pressure, diastolic all high, over 180, and your diastolic is over 90, 110, or 100. Wow, that's scary stuff. Plus, you are a person don't move much. I don't do exercise. I just sit around doing anything. Plus, you take a lot of alcohol, drink a lot, whiskey, beer, and I smoke. Wow, all these factors became your real risk for you to get heart attack. 心臟病嘅危險因素咧係好多種嘅。第一，係糖尿病，咁就已經增加晒，因為60% 嘅糖尿病者有可能會有心臟病。第二，肥胖過重，你 BMI 過30，我大肚墩全部係44寸個肚墩，哇！你個 chest 好高 ，OK？ 同埋我食嘢咧，亦都成日食啲係好多油啦，有好多脂肪嘅東西啦，又食到好多糖啦嘅東西啦，咁呢個亦都係幫助你係心臟病嘅。高膽固醇亦都係啦，尤其是 LDL 膽固醇啊 ，LDL 膽固醇啊，因為好多時咧就話哇好瘦喎，點解我高膽固醇㗎啦？could be因為你 parents 或者你爸爸媽媽細佬你係家族性嘅都得嘅喎，同埋你帶啦當然係啊。咁即係血壓高，如果血壓高過即係140以上啊，或者你底下嗰個90咧，呢個亦都係增加咗你風險嘅。咁同埋咧，我係個人唔喐嘅，我唔做 exercise 嘅，冇習慣嘅。咁就話飲好多酒嘅，啤酒、烈酒全部飲，我又食煙嘅。咁呢啲嘢咧係全部咧都係你嘅風險。 Another thing too, another factors that might help, might cause you more problem is also I have a lot of stress. My work, oh my goodness, I work to 1 a.m. every morning. That will be a real person that potentially have a serious heart attack. I just have a banker. He makes a lot of money, by the way. He is really a very rich guy. But unfortunately, his health become very, very poor at the end and end up he has to actually quit his job. The reason is one, every day work to 1 o'clock because, you know, he had to stop talking to people. Although he make a lot of money, he also don't entertain a lot. He go eat a lot. So he is very, very chubby. His heart is not doing well. And at the end of the day, he basically has to retire abruptly because he is going to die. Basically, his heart is going to be all screwed up. So end up, you know, stress can be a tremendous issue. Your cholesterol, tremendous issue. All that add up. Plus, he's a man. And also a family history, potentially. You also have family history, you know, as I say, your brother, mother, everybody who have high history of heart disease, you might have heart disease potentially. Plus, you potentially have drug stimulate, and also that can be an issue too. And also, last but not least, preeclampsia. In other words, you're pregnant, and unfortunately, when you're pregnant, you have high blood pressure, preeclampsia, high blood pressure. You can also stimulate heart attack. So all that factor can be part of your potential heart attack. 嗱，各位堂友，好弊咧就係仲有情緒啊，唔好唔記得。工作壓力大咧係對你講係好有問題嘅。嗱，講啲真實故事俾你聽。我有朋友係做銀行嘅，哇，好有錢啊，即係百萬富翁之一。但係個問題壓力好大，佢又成日去飲酒啦，同個客傾偈啦，有錢係點啊？個問題個心搞唔掂。佢個心已經係肥大晒啦，咁同埋咧個醫生話你不如，如果你唔 quit 你就不如唔喺度噶啦。咁佢真係要 end up 就好 abruptly， 即係忽然間要退休，唔做得。佢心臟病同埋依家行路都好有問題，因為佢整個心係已經壞得好緊要。咁所以變咗嚟講咧，其實情緒壓力、工作壓力，你真係要 relax 啊，唔好自己咁緊張啊。咁仲有咧，藥物嘅興奮劑啊，呢啲亦都有對你係有問題嘅。男性記唔記得？男性係高過女性嘅有 heart attack 嘅。咁就家族啦，如果啲家族你爸爸媽媽、uncle 啊，或者你個子弟咧都有呢樣嘢，有呢個心臟病咧，咁你咧 most 都要更加 check 多啲啊，即係心臟病你會可能有啦。咁仲有咧就係如果你懷孕時候血壓高咧。咁呢個咧亦都有機會咧令到你有心臟病嘅。So we have talked a lot about this before, and I said so important to prevent your heart attack as a diabetic or pre-diabetic. One of the important is your lifestyle have to change. And this is so important because when you have lifestyle change, you decrease all that issue coming along because you know why? Your blood sugar are lower. And then blood sugar lower, and your cholesterol will be lower, and your blood pressure will be lower. And you know what? Your heart health is going to be so much better. And your vessels are not plugging everywhere. So that way you survive much longer. So you avoid all the different potential heart problems. So how do you do that? Lifestyle change is eat healthy. In other words, half are all vegetable, and 1/4 is what? Your protein, fish, not red meat, fish, or a little bit meat, but a lot more fish and other protein. And then the rest is 1/4 is other your starch, but instead of really starch, eat beans, oatmeal, things like that with high fiber. So all that, what you do, you lower your blood sugar, cholesterol, and eventually your blood pressure will be lower. Now, you also have to do exercise. I said we're going to do 10,000 steps 3 or 4 times a week, and you do 150-minute exercise. When you actually do a lot of exercise, you know what? You help to improve your insulin resistance. Your insulin will work better. So net result, you will utilize many of the excess sugar, so you don't have the sugar plug all everywhere in the blood vessels. Plus, you cannot be overweight. If you continue to be overweight, when problem comes on, your BMI over 30, you're gonna have a problem. You gotta get a BMI under 25 or all the way to 23, even better. So with that, you can able to 10% of your weight went down, you have minus 1% your A1C. Wasn't that really wonderful? So you have less chance of plug everywhere. Plus, you have to measure your blood sugar all the time. Understand that your blood sugar are not high, so you can prevent yourself. And really important that you have to continue to prevent your blood sugar to go high, because if you don't measure yourself, you have no idea to understand what happened to your blood sugar. Okay, so as a diabetes, you have to measure that to understand. And you don't really smoke, and you don't really drink a lot. And you know what? Because I drink LOWSUTEA, my blood sugar is 5.9, or this is like 100. Okay, so drinking LOWSUTEA will help you really lower your blood sugar. You notice I don't even move up to 8 when I ate breakfast. So that's why LOWSUTEA will help you. And I also found if I don't drink LOWSUTEA, eat a lot, you know what? Blood sugar goes up. Simple as that. And many of my diabetic friends tell me if they go to eat a lot, they drink 1 extra bag LOWSUTEA, the blood sugar drop back real fast. So LOWSUTEA definitely help you to lower your blood sugar, and you have to continue to try to get yourself in the lower blood sugar mechanism to help you. Okay， 嗱，各位堂友，好簡單，你一定要保持咧你血糖係低，同埋咧咁先能夠令到你身體健康，保護一個係好嘅生活習慣。咁轉你嘅生活習慣咧係一個最好嘅防禦你心臟嘅病嘅問題嘅工作嚇。咁我有咩咧？其實第一喺健康嘅飲食方面咧，你一定要做到啦。咁啊，我不嬲講開啦，一半日日食一餐，一半都係全部係咩啊？菜嚟嘅，然後1/4係咩啊？係我嘅protein 我蛋白質，蛋白質食咗咩嘅啊？魚啦，唔係紅肉啊，魚多啲魚或者係雞肉，肥唔係肥嘅雞肉，係瘦嘅雞肉，瘦嘅細肉，少少肉牛肉都係唔係肥嘅。嗱，仲有1/4係咩啊？食多啲係呢個豆啦，或者食啲係麥皮嘅穀類啦、紅米啦，呢啲係全部係好多 fiber 嘅，咁變咗嚟講，令到你嘅血糖係永遠係繼續係控制到嘅。咁仲有咧，每個禮拜做運動喎，運動150分鐘，行1萬步，係咪？仲有啦，重磅，你 BMI 降低到25，由30降到25，同埋咧或者係降到43更加好啦。咁因為咧，如果你降低10磅咧 ，guess what？10% 啊，10唔係10，唔止10磅啦，10%，你降低1% A1C 啊，哇，好重要啊！咁就係一定要度血糖，同埋咧就每日都要度血糖，每日度幾多次啊？最低限度要度4次，同埋咧最好如果你有機咧，買咗個 Abbott 機咧，咁你成日都度到啦。嗱，你幫我飲咗去糖茶啦，嗱，唔好飲酒同埋呢個唔好去食煙係好重要嘅。咁但係咧飲咗去糖茶咧 ，guess what？ 我嘅血糖咧係5.9啊！日日飲去糖茶，一日係飲8杯，8杯去糖茶就幫助你係降低咗係你嘅個糖咧係去到5.9嘅，加幾緊要啊！咁我其實依家好多糖友咧飲咗去糖茶之後咧，仲有咧就係譬如去食多啲嘢啊，或者食 buffet 啊 ，guess what？ 飲3包，唔係飲2包啦。咁佢哋覺得話，哇！飲完之後咧，啲糖好快落翻嚟。嗱，千祈唔好咧令到啲糖咧繼續喺上面游嚟游去，咁呢個咧就好大問題㗎啦。So remember, actually, heart attack in diabetes has a different type of heart attack. You know why? They have what they call a silent heart attack, which is apparently had not a lot of symptoms, as I mentioned to you. And you can be harm your heart and starting getting a scar tissue, and the next heart attack will be extremely powerful. You might even end up dying if you don't get treated right away and I'm aware of this heart attack. So net result, you really, once you have some sign and symptom, you better quickly go to the doctor and check it out. So you can do an angiogram, can able to understand where is your heart is going to be, and so you can able to improve or control the damage of your heart so you can continue to be healthy. So that is very important. You don't want to get the heart attack without recognize, never treat, and then result the heart suddenly stop and you die, basically. So very, very serious, yeah? Okay. And so講得記住，因為咧呢個糖尿病者嘅 heart attack 咧係同普通人咧係唔同嘅。有咩唔同咧？就係因為咧佢係冇呢個真正嘅好似 sharp pain 嗰啲東西俾你啊，因為佢冇個感覺啊，因為個糖咧係塞晒嗰啲神經系統咧，咁個感覺上係冇嗰啲普通嘅人嘅 heart attack 一樣嘅。咁變咗嚟講咧，如果你有嘅 heart attack 係已經有些少 heart attack damage 咗，咁個已經有 scar tissue， 咁你又唔去處理咧，下一次嘅 heart attack 就好勁㗎啦。就如一 heart attack 嘅時候咧，個 muscle 一死咧 ，guess what？ 你又真係玩完㗎咯。咁希望你哋咧要記住，如果有些少嘅問題開始發生咧，你快快去睇醫生，因為第二次咧嗰個嚴重性就好高啦。咁如果你係想睇個 symptom 係乜嘢啊，咁記住呢啲啦。So the next one is, that's why I ask you guys all remember your silent heart attack really is sign and symptom. You got to remember, you are very different from other people. So you got to feel tired and fatigued. You may have some nauseated, a stomach upset. The sad part is majority of these people will suddenly thought that, wow, hey, is it a stomach problem? We have a flu. But actually he has a heart attack or she had a heart attack. So you got to really you have this problem, don't ignore it. You got to go to see a doctor, especially your leg start swelling, you start getting some heartburn, you start having a difficult breathing. The early sign is here, more severe sign coming. The more really severe side it'll be there is now you're going to start getting a squeeze on the chest area. But the difference is you don't have sharp pain because your nerve damage is already exists. You might not feel the pain of this area. So you might have a real just a dull pain, maybe radiate up the neck. That's about it. So really at the end of the day, the major difference is the sharp pain. And you don't have that. And also you gotta get sweating, and then you feel dizzy and lightheaded. They all come along, keep coming along and getting more serious. When you have that, you know what? You have to go hospital, emergency, call an ambulance to help you out. Because when you have the problem on the left side, you better go get your medical treatment fast. 嗱，各位朋友，記住。點解我繼續去講呢樣嘢，叫你影張相咧？因為咧糖尿病咧，你個心臟病同普通人係唔同嘅。你有個叫做 silent heart attack， 咁你多數覺得好攰啦，可能有少嘔吐嘅感覺啦，或 stomach 會 upset 啦，咁就腳又會腫啦，有少 heartburn 啦，同埋咧你個亦都有少好似覺得好唔舒服，唞唔到氣咁啦。好多人咧誤會咗咧，我有個 flu 或者有 stomach problem， 其實就唔係，你已經開始有 heart attack。如果你糖尿病病者，記住。咁當你嚴重啲嘅時候咧，你就開始係有個兜 pain 啊，即係好肉燒咁但係唔係 sharp pain 喎。咁 major difference 咧就係普通人就有 sharp pain， 你冇白 sharp pain， 你有兜 pain， 或者 radiate up to neck 上到呢一度。咁同埋咧又 feel 冷汗，同埋又 feel 好攰啊，暈陀陀啊。 咁其實呢個情況發生嘅時候咧，就點啊？你要去入醫院，入醫院都係叫十字車，快快脆脆。所以我叫你各位咧影一張呢個相咧係有原因嘅，就希望你各位知道咧，原來你有 heart attack 係呢個係 silent heart attack 咁嘅。The reason why I ask many of you to take this picture because I really hope that you can remember some of the signs and symptoms of the silent heart attack for diabetes. Hopefully with that, you can remember on your camera, at least you can say, I remember this is my sign and symptom. If you have that exhibition, you better quickly get medical attention. And I hope today, if you have that, you can have a much better chance to survive a heart attack. You can be healthy, and hopefully that you can remember your type 2 diabetes. You gotta really, the diabetic will not get well. You can only control a disease. You can control a diabetic complication by dieting, by your exercising, by control your blood sugar, control your weight, and then you got to change your lifestyle. And so we can, if I can lower your 3 high, you have much better chance to survive. And more important, drink LOWSUTEA, because LOWSUTEA definitely will help you to lower your blood sugar, your cholesterol, your blood pressure, and detox. And that would be wonderful to get you healthy. So I finished my webinar today, and I'm here for getting a question answer. By the way, right now we have a Hawaii Facebook page. It's called LOWSUTEA Hawaii. So if you are go to Facebook, you can look for LOWSUTEA Hawaii. Definitely you can actually contact, and there's all kind of information in getting onto the LOWSUTEA Hawaii Facebook. So people like Eugene, and spread the word. You can actually see LOWSUTEA Hawaii. Hopefully you can able to get more friends to listen to our webinar, and hopefully they can get benefit out of the diabetes problem. And so really I think it's so important to prevent your diabetes. Is so important. I appreciate Eugene. Good to see you to seeing the webinar here. I wonder if any more questions from the Hawaii people, from the Philippines, from Hong Kong. If you have, you can ask now. 各位朋友，如果你有任何問題，你可以問嘅，我哋可以希望可以答到俾你啦。咁啊，多謝你各位今日係能夠聽我哋嘅講座啦。其實呢個係好重要講座，因為個問題咧，好多人都唔知道，原來咧糖尿患病者係對心臟病咧係一個好大問題嘅。咁同埋咧，仲有咧係令到你係連個痛嘅，即係多數人心臟病一個 sharp pain 咧都冇咗喎，哇，好弊，係咪？咁所以變咗嚟講咧，就希望我哋各位即係注意做呢個啦。OK， so people from Hawaii, look at the LOWSUTEA Hawaii Facebook, because this is a page we established because we have so many people from Hawaii that who are interested LOWSUTEA. So we established a Facebook page for them, and you can actually pick up your LOWSUTEA also from the Ohana Enterprise, or write to them, or write to us also. We can give it to you. So that way you can able to try LOWSUTEA. So any other question from the webinar floor? If not, I will wish you a very healthy weekend. I hope that you will be continue to control your blood sugar, really go for your dieting, your exercise, the weight control, and also measure your blood sugar and listen to our webinar. Okay, I appreciate that, everybody. Have a very nice, wonderful, healthy weekend. Goodbye. Hey, thanks, Eugene. Thank you for you coming back to see us. Thank you very much. Bye-bye.